Hi, I'm Dr. Melanie Palm from Artist Skin MD in Solana Beach, California, here in San Diego, and today we're going to be performing Ultherapy. And you'll see a lot of information out on the web about the discomfort level associated with Ulthera and Ultherapy. And it's something I always talk to patients about, and it's something I'm always concerned during any procedure with patients. And we really try and do everything we can to mitigate pain. And for that reason, this patient, which we've already prepped with some local nerve blocks, we've done some novel things. So we've actually done a block around the chin area that helps sort of in this lower area of the cheek. I've blocked her around the ear, and that helps the ear area and some of the lower neck. We've done a little bit of infiltration in the cheek, not enough to affect the treatment, but enough to make it comfortable in this area that we call the buccal cheek. And then interestingly, I've done a block all the way down the side of her neck. And typically, I hadn't done that on patients during Ultherapy, and with a little bit of cool air, they do great, but there was a level of discomfort. And today, we've actually started to do a block along the side of the neck. And this patient who's actually had Ultherapy in the past says that she really doesn't feel anything during treatment. And I think the neck has been the most challenging area in terms of pain control during Ultherapy. And so it's wonderful to be able to give the patient good, comfortable treatment during this, and really becomes a breeze. I mean, it's nothing, uncomfortable during it, and it's about an hour procedure and you accomplish a lot. So the purpose of Ultherapy is an ultrasound device, and it's used to target that ultrasound energy deep within the connective tissue, so below the skin, below the fat, into these tough connective tissue layers that typically facial plastic surgeons use to rebuild the neck, the face, or even the brow when they're doing things like neck lifts, facelifts, and brow lifts. So this energy is used and harnessed. It heats up that connective tissue and causes new collagen growth. And as that happens over the next 3 to 6 months, it causes the tissue to tighten. And that's what gives tone and tightening to the neck area, to the cheek area, and even around the brows and the under eye area. And there's 3 different depths that we use. So most users will use a 4.5 millimeter tip and a 3 millimeter tip. And that gets at those connective tissue layers. For more advanced users, we also use this 1.5 millimeter handpiece. And for the neck, to address the crepiness, it's something that might induce a little bit of collagen growth in the second layer of our skin called the dermis. And around the eyes, it may have that same effect in helping crepey skin and tightening that area, which is so stubborn and so hard to address, even with lasers and injectables. So I want to demonstrate just a few pulses so you can see how comfortable this is for the patient. We're starting out with the neck, then we're going to work on the cheeks, and then finally end up around the eyes, but I want you to see what it is to do a few pulses in this neck area. If you were to do a full neck and the full face, you're probably talking about a number of pulses, which we call lines, in the ballpark of 800 to 1,000 pulses. I tell patients for the upper part, just doing the face, somewhere in the 600 to 800 line mark is a great place to be. Patients do see a tightening effect right afterwards, but really the results are gradual and happen over time. So I tell them to give them at least 3 months and even often up to 6 months to sort of compare the before and after photos to see the tightening and toning effect. So with that, we're going to get started. And I want you to take a quick look at this Ulthera screen. So this is the ultrasound feedback that we have. The scan is on, and I'm going to put it against the tissue now. And what I see here is a nice screen, and you want to make sure that it's even and that there isn't much in terms of gel on the top, and I see that nice connective tissue layer just right below that green line, so that's a great spot. So I'm going to go ahead and do a pulse. How was that? I'm good. And then again, that's a really nice position. And so I won't belabor the point, but I want you to get an idea of what that's like, so that, pulse takes less than a second to do, and we're going to continue that for the treatment. For full face, usually about 60 minutes. If we're doing a full neck, a little bit longer, but as you can see, the patient's really comfortable. Sometimes we use other aids like vibrational tools or a little bit of cool air if they want something for distraction. And with that, we invite you to ask questions. See our website at www.artistskinmd.com or give us a call at 858-792-7546. Thanks so much.